Dr. Arafid from Vet Triage. We are going through a brand new issue of JAVMA, January 15, 2015, and we're going to do a What's Your Diagnosis? This is a 3-year-old intact female North American beaver owned by a local zoo. It was found passively floating in the pool, unable to stand. It was depressed. It was previously healthy. No other beavers were sick. Adequate nutritional status, no other abnormalities on physical exam besides a bloated appearance and lethargy, no history of trauma, no abnormalities were found on basic blood work, and so they collected radiographs. This study comes out of a hospital in Massachusetts and the University of Tennessee and University in Ohio. And so these are the radiographs here. So let's go over what we found. You can see a generalized decrease in serosal margin detail consistent with abdominal effusion, steatitis, or peritonitis. The small intestines are diffusely dilated with gas, and the stomach is distended with a mixture of soft tissue or fluid opacity and gas. Large intestines displaced, obscured by dilated small intestine. Multiple small amorphous gas opacities along the ventral aspect of the abdominal wall overlying the ventral margin of the stomach. It's right here, these little dots there. And that may be free abdominal air like pneumoperitoneum or gas inclusions in the gastric wall due to necrosis or ulceration. Paralytic ileus was a top differential diagnosis for generalized severely dilated intestinal loops. Mesenteric torsion was considered unlikely because of the concurrent gas distension of the stomach and because an even more severe degree of intestinal distension is usually seen with torsion. No recent history of surgery, no blunt trauma. Bacterial septic enteritis or peritonitis was considered most likely underlying cause of distension of the GI tract. Possible underlying causes of spontaneous pneumoperitoneum could be GI perforation or bacterial peritonitis. They took the beaver to surgery for exploratory laparotomy and found extensive diffuse peritonitis. Stomach and small intestines severely diffusely distended, discolored, with no motility. They euthanized the beaver, and final diagnosis of bacterial gastroenteritis with septicemia was made. Comments. This condition is characterized by vascular or neuromuscular abnormalities within the intestinal wall, resulting in cessation of peristaltic contractions. Although overlap with radiographic findings in obstructive ileus exists, paralytic ileus should be the primary consideration if there is extensive uniform rather than focal intestinal dilation. It is unknown whether the paralytic ileus was caused by septicemia or the sepsis was secondary to the ileus in this patient. Paralytic ileus is believed to be the result of activation of inhibitory neural reflex pathways and activation of inflammatory processes. Septic shock can severely impair GI function. The stagnant nature of the GI tract causes extensive accumulation of bacteria within the intestines, and the buildup of bacteria within the compromised intestinal wall is thought to contribute to translocation of bacteria. The decision for surgery was because of concern of gastric pneumatosis, which is seen in dogs with gastric dilatation and volvulus, but which only has a positive predictive value of 41% for gastric wall necrosis in dogs with gastric pneumatosis from GDV. Incidental gas inclusion seen in the rest of the patient population was attributed to gas under pressure being forced into the submucosal tissue through the mucosal breach. So for veterinarians, this is a good study, even though it's a beaver and most of us don't see beavers, and just interpreting GI radiographs and how you kind of differentiate between all these different differentials. And then for pet owners who who see abdominal distension in their animals, you could have something as innocuous as what looks like just lethargy and a bloated stomach, but it can actually be a very serious condition. Every animal reacts differently to that, and you can see in this case, this animal was clearly septic, and so didn't show any other symptoms as far as they know other than lethargy and abdominal distension. So it's important to consult with a veterinarian, vettriage.com, and make sure that what you're seeing is truly innocuous or not. All right, we'll see you in the next one. Take care.